Kentucky Democratic Governor Andy Beshear joining me now. Governor, it's very good to see you again. You are one of the governors who have joined a bipartisan op-ed written today in the Washington Post, published in the Post. 6 other governors in the Midwestern states, just north of you, calling for people to stay home, stay safe during the Thanksgiving holiday. So I assume you're not surprised that the CDC has made this announcement today, this recommendation.
Not surprised at all, but grateful they're out there providing the true information that people need. Thanksgiving is one of my favorite holidays of the year. It's a time when we hold our families close, and we are thankful for all of our blessings. Well, one of our blessings this year is that we have more knowledge at this point about how this virus spreads and what we can do to protect one another. If we do Thanksgiving the way that we've done it in the past, it threatens to be the largest super spreader event we have seen thus far in our battle against this virus. And I don't want what people do during Thanksgiving to mean that other Kentuckians aren't around for Christmas. So listen, we're at war with this virus. It means we have to do Thanksgiving a little different. But I'm thankful that we've got that information and we can protect one another in how we celebrate it.
And what are your restrictions? How have you updated the restrictions for Kentucky?
So here in Kentucky, we are in our most dangerous place we have been during the course of the battle against this pandemic. We have now hit exponential growth. It took us, 6 odd months to get to our first day where we had 1,000 cases. It took about 2 months to get to our first day where we had 2,000 cases. And in about a week, we are close to moving from 2,000 to 3,000 cases. Now is the time to fight back. I don't believe that we surrender and we accept fatalities in this war against COVID-19. So what we've done is we have taken targeted surgical steps because we know so much more about how it spreads than we did back in March and April. So for the next 3 weeks, we've closed our bars and our restaurants to indoor dining. We still want to support them. We want to do carry out, and if it can work, outdoor seating, but we know spread is occurring there. We are limiting gatherings even further down to, at any time, just 2 households with the same definition that the CDC is using. We have had to curtail gyms, indoor recreational facilities. We've had to pause the winter sports, which could be dangerous until at least past December 13th. And we've also had to take a step on moving our schools to virtual learning. Now, I see the debate on New York each day, and I wish we in the Commonwealth were there at a 3% positivity rate. We're at a 9% positivity rate in exponential growth. And what that means is the virus is pushed through all of our defenses. Our long-term care facilities, where we test those workers 3 times a week, are all of a sudden being flooded by this virus. We lost 25 veterans in one veterans home in the last couple weeks with everybody trying to do it right. The only answer is to take the steps we need to tamp down this virus, because as our cases go up, there are more people who need help, medical help, that are going to need a doctor or a nurse. And as we saw with the Mayo Clinic, the more cases go up, the more healthcare workers get infected, and our capacity to help them goes down. So now's the tipping point. Now's the point where we absolutely have to act, and we're doing that here in Kentucky.
Well, it's just extraordinary. And I know from just yesterday, Wisconsin was at a 41% positivity rate. Wow. I mean, nearly half the people tested. It's just frightening. We've just learned now that for the first time in weeks, the White House, after one of their task force meetings, is going to have a public briefing at 4 o'clock in the briefing room today. So we don't know who's going to be briefing, but we do know that the White House task force is now taking this seriously. Just yesterday, I was interviewing Admiral Giroir, and he was very concerned, and there was a real difference in his tone, in his warnings about Thanksgiving in particular. Are you still getting briefings from the vice president?
We are getting briefings from that task force. The vice president is on most of the time. And listen, this administration has communicated well with us here in Kentucky. They provided us surge testing that we have going on in 2 locations. Communication has never been the problem, and so we appreciate that. But
well, let me just ask you that, Governor. But are they urging, when you're on those calls with the governors, are they urging Kristi Noem in South Dakota to take on the mask challenge, as now North Dakota and Iowa and Kansas are? I mean, are these resistant governors being told how serious this is by the vice president himself?
Well, that doesn't happen during the calls, but I know 2 things are happening out there. Number one, we get recommendations each week in reports to each state, and they are very direct and frank. The report from the White House agrees with the steps that we've taken here in Kentucky, and agree that the spread is happening where it is. They haven't been shy about stepping up and saying a mask mandate is necessary, and I expect that same advice is given in a report to South Dakota. The other thing is Dr. Birx herself has traveled across the United States, and she has been very direct with individuals as well. I know is direct with the governor of Tennessee.
And let me ask you also about Kentucky, because Mitch McConnell has sent the Senate home. There's a surge in the Senate. He's losing a key vote with Senator Grassley, unfortunately, having COVID, and so now he doesn't have the votes to pass the confirmations he wants. But has anything been said to Mitch McConnell from your folks at home about the lack of COVID relief? Because now Congress has gone home without passing it.
We do talk about it. I think that the senator and I have a disagreement on what needs to be within that package. We got a lot of people out there who are hurting. On the economic side, we have our restaurants and our bars that we're having to take some heartbreaking action against that need real help to survive, and only the federal government's going to be able to provide that help. But it's more than that. If we don't get another CARES Act funding before the end of the year, everything we're doing to fight this virus falls off a cliff on December 31st. No more money for testing, no more money for contact tracing, no money to distribute this vaccine. By not getting that package out, and some of the issues we're seeing in the presidential transition, makes me worried that we are going to push back how quickly we can get this vaccine out by weeks or even potentially a month. And when we're talking about a 95% plus effective vaccine, 2 of them, there's so much light at the end of the tunnel. Let's not mess it up. Let's do what it takes to get to that better tomorrow, which means Congress got to work together. And we got to make sure that there is a smooth transition between administrations.
Thank you very much, Governor Andy Beshear. Thanks again for being with us today.
Hey there, I'm Chris Hayes from MSNBC. Thanks for watching MSNBC on YouTube. If you want to keep up to date with the videos we're putting out, you can click subscribe just below me, or click over on this list to see lots of other great videos.